Welcome to the Chad G Ortho OT podcast. I'm your host, Chad Guerrero. I'm an orthopedic occupational therapist, strength and conditioning coach, sports trainer, and I hold over 40 specialty certifications in manual therapy, orthopedics, and sports medicine. On this podcast, we will discuss everything orthopedic therapy, sports medicine, and more. If you're a therapist, health and fitness professional, or someone just wanting to learn more about the orthopedic and sports medicine world, then this is a podcast for you. Let's get started. Welcome to the Chad G Ortho OT podcast. I'm your host, Chad Guerrero, and today we're going to talk about headaches again. So I did my first podcast was on cervicogenic headaches and kind of what goes along with that and how to check yourself at home. And, that one's pretty popular as far as my other podcast episodes that I've done. That one probably has the most listens on it. And, because that's something that everybody suffers with just about it. I mean, we all have headaches, tension headaches and sinus headaches and neck pain associated headaches and, all these kind of things. Children induced, if you've got kids you take care of. I have 2 kids, so sometimes that may cause a headache, right? It's a lot of people not really sure where to go for that. Where do I need to see a family practitioner? Do I go to my acupuncturist or an acupuncturist? Do I go to a neurologist, or kind of what do you do? And what's the direction to go into? And I think this is one of those things where if it's maybe migraine is what you suffer from migraines. Well, probably a neurologist needs to look at that. But at the same time, a lot of therapists are very well trained and skilled at assessing headaches and, of course, neck pain and head pain and all that kind of stuff. And so finding a therapist that's really good at that, pretty skilled at it, had a good amount of training in it, it really can be beneficial, regardless if you see your physician or whatever, and depending on the state that you're in, if you have direct, or country, if you have direct access, or if you have to have referrals, or if you take insurance. I know there's these different pathways that we all have to take to get things done, with our healthcare systems, right? But I think that finding a therapist is a good route to start with. And so today, just kind of talk about an interesting case that I had. Not really, I don't want to say interesting. I guess they're all interesting, but this particular case had a patient come in, and I want to say this is pretty common. They come in, doesn't really know what happened, kind of where this come from. Just kind of out of the blue, started having this severe neck pain that was focused more on one side, and it's actually left-sided, and not really sure what's going on, just excruciating pain, causing a lot of issues, and as well as headaches, and now having some dizziness, and what's going on. Because I think a lot of people initially, you just really worried, like, oh my gosh, did I herniated disc? Do I have a bulging disc? Or this particular patient said, gosh, I don't know if I have I don't have like a tumor or something like that it's growing into my spinal cord or my head or whatever, which all those obviously are possibilities, but they're not that common. And so started talking to the patient, kind of going through what's going on, and, think back to see if anything may have, kind of built up to cause this issue. And, ended up, patient says, well, about 2 days prior to this initially hurting, or 2 or 3 days prior, had a massage, pretty lengthy massage, around the cervical spine. I don't know if it's full body, but I know the cervical spine was involved. And, again, a few days later, starts to develop this pain, etc., and stiffness and inability to turn the head and all that. And then it gets better for a while, and then it comes back, and it just seems to just be unrelenting. It's just not getting better. And, kind of what's going on. So, for me, the first thing that I do, obviously, taking this history in to kind of see what's going on, where this may have originated from, what the person's been doing as far as, anything from eating habits to sleep habits, the medication changes, activity level changes. Have you been in the yard doing anything? So I go through all those kind of things, just kind of trying to determine, what could be something contributing to this. And in this particular patient, the only thing that just obviously stands out was had this massage just prior to, and then this issue comes up. And so I went through, we did a, range of motion assessment, just an active range of motion. I like to just watch the patient move first. and see what that looks like. And I don't try to bias that in any way. Just let them move and, look up, look down, rotate the head and neck right and left, and head nod, retraction, all these kind of things, just to kind of get an idea. And then see what the upper extremity movement is. And in this case, the left arm was affected. So raising the arm overhead or to reach behind the head, like in a functional external rotation position, like you're going to wash your hair, things like that, was pretty limited and difficult, and varied based off of the symptoms on that particular, day or moment. And so then also said that they were having some headaches, which were primarily unilateral. They're on the left side, kind of come from in the neck back there, upper cervical area, come over the top of the head. There was a spot right in the top of the head that, kind of was a pinpointing spot that bothered them. Then went over the left side into the frontal lobe area. And, nothing radiating down in the hand, the fingers, nothing like that. I did not do a cervical compression or Sperling's test on this patient because of the pain they were having, just additional kind of disc clearing or space occupying lesion, clearing. I didn't do that just because of the pain that they were in, having a pretty severe headache today. And I did a Hoffman's sign of the nail bed scratch test. That's a check for like an upper motor neuron lesion issue, which was negative. And, from a reflexive standpoint, all that was all normal, no issues there. A little bit of forward head posturing. And so, with the forward head posture, which I'll kind of get into, this is kind of why I think this happened, or she was a little bit set up for this. But a little bit of forward head posturing, and of course, the more the patient said if they yawned a lot and really opened the jaw up, then that pulled on the neck, and so it was uncomfortable. So if they went into like that, protrusion movement with the mandible, and then if the head was in a forward position, then of course it got worse. And so anyway, the patient couldn't lie on their back or stomach, so couldn't do like a good. And you could do a seated P to A assessment on the vertebrae, but could not do a prone P to A assessment, and then could not see in supine. Couldn't do like a flexion rotation test or anything like that because it was so uncomfortable and so painful, and just really carrying, her traps and shoulders and everything very, very stiff. And so, anyway, so I didn't do very much of a passive assessment, which I normally would do. I'd go active and then I'd go passive, and then I go into just provocation tests to try to see a little more about what's going on. But so anyway, and then just kind of looking at her, this forward head posture is there. And so the patient says, well, do you think that the forward head posture, could be causing my issues? And, because I have bad posture. Now, I'm a big fan, and this is just me, but I'm not like a good posture, bad posture person. And a lot of folks that I follow in social media, therapists and different healthcare folks, I mean, they've kind of all taken the same approach on that. I don't think it's necessarily good and bad posture. I think you have to have variability of posturing, right? So none of us are made to be in like this fully extended, almost erect position all the time, because, that's not good for the tissue of the joints, I would think, just as much as, being very forward rounding and slumped and slouched and all that. I think you just have to change that up, just throughout the day, just your movement, so that you're optimizing and you're kind of keeping calibration of the full range of motion of all of our joints. And so she did have a little bit of the forward head posture. I would say maybe moderate if I'm kind of grading it on my scale. And so it was forwards. And so, when that's forwards like that, we're asking the muscles throughout the day to keep a little extra tone and tension to hold the head in that position. And then I also want the muscles to function, right? So if you took a 5-pound dumbbell and you were going to curl it, right? And you curled it up in the elbow and you're holding on to it, and you hold it there for, I don't know, you probably could hold it for a long time, or at least a while, because it's only 5 pounds. But then after that, I said, okay, as soon as you get done, put that down and grab this 30-pound dumbbell, and I want you to start curling it. Well, you might could curl it some, but you're not going to be able to curl it very, very much, because you've already fatigued muscle fibers, right? Because you've been statically holding it in this position. So it's kind of the same concept with the head and neck. If we're in a certain position, we're holding that position all day or for however long, and then we ask, the muscles contract and move the joints and all that, then, they're just fatigued. And so they may be more apt to spasm. And so I think that was she was already there getting a massage because the muscles were tight. She had increased tension, right, in this particular area, which is most likely from muscle weakness, poor muscle endurance. I was not able to also do a deep neck flexor endurance test or neck extensor endurance test, anything like that, because of her pain. So, very likely those were causative factors that led up to this deep tissue massage, because all these muscles were on the verge of having full out spasms anyway. You had the spasming that causes tension within the facet joints, right? And that compresses those down. The facet joints, for those that are not healthcare providers, that's the back portion of the vertebrae that carries 50% of the load, so 25% of each facet of each vertebral body. And so the disc, the intervertebral disc that's there, carries 50% of the weight and the pressure, and then the other 50% goes to those two facet joints. And so you're clamping down, so to speak, on these facet joints. You run the risk of causing nerve root irritation where the nerves come out. And then this patient ends up with basically a cervicogenic dysfunction, which is an irritation most commonly in the C2, C3 area. And that first podcast I did was on cervicogenic dizziness and I think headaches or vice versa, kind of going together there, just because when that becomes hyper irritable, and it can cause pain and dizziness and headaches and all these other things. So in this particular patient's case, we had to just be really careful, really easy today, do some light techniques. One of the things I do want to point out is I know that a lot of folks, the main thing to go to is, well, I need to stretch my neck, right? Or whatever body part this is, I need to stretch. So by the time that we get you, in most cases, it's been going on for a little while, you probably have already tried to stretch and it probably has not worked, right? Otherwise, we wouldn't be looking at one another. Now, I'm not saying don't stretch, because stretching is beneficial, right? I'm not saying that. I'm just saying maybe we need to add in some things. And I like to add in what's called low threshold isometric contraction. So I will post a video on my YouTube and on my other social media, Instagram and all that, on low threshold isometric contractions for the cervical spine, because I think that by doing that, we can kind of click on and click off the muscle, kind of let the brain see, like, this is not as severe of an issue. There's nothing damaged here. See, this is the muscle contracting, then this is the muscle relaxing. Okay, this is how this should normally fire, and not just contract and stay fired up and tightened up the whole time. So, and I've said this before in other episodes, like, the brain is easily tricked sometimes, but it's not easily convinced. And so we do some tricking to allow for more movement and, functional ability to occur, but then we have to try to keep it somehow. And so that's the home program that people need to do. I'm very big on doing your home program. I think that's very, very important. You definitely need to, continue with your things at home. And so I gave this patient 3 movements to do, 2 isometric movements, and then an active cervical retraction movement that I wanted to be done every hour, 2 or 3 reps, hold for a couple of sets. I don't like to give people this big, booklet of exercises, of the proverbial 3 sets of 10 or whatever. I don't like to do that. So I like to just kind of vary that up and just kind of give them a collection of things to do. And so if you say, like, okay, I want you to do these things throughout the day, just whenever you get time to do it and you think about doing it, people are much more likely to do it and comply. And then that's going to help keep some of the things that we are accomplishing in your therapy session, whether that's through manual therapy, hands-on techniques, or exercises, or whatever we're doing. But by you doing those things at home, that helps to maintain that. So anyway, I just want to share that. And I guess the main gist of the whole thing is sometimes, if you do other things other than stretching and applying heat, if those things aren't working, a little leave or whatever you take, and those things aren't working, then those low threshold isometric contractions and little active movements can be very, very effective if done, correctly. And of course, as always, don't perform any of these activities, exercises, or techniques that I say or comment or text about or whatever without consulting a healthcare provider first. That's my disclaimer. But anyway, definitely something that you can try that I think will help. And I'll post that video. So if you'll go to, you can go to my website and it'll be from there. You can go to YouTube. I'm on YouTube, Instagram, TikTok, all this stuff. So I'll put that on there for some examples for you to be able to do at home and see if it helps your headache. So, thanks so much for listening, guys. I appreciate all the support. Continue to get great support from everybody. And I thank you all so much. And you guys have an awesome day. This podcast is brought to you by Guerrero Rehabilitation, setting the bar for rehabilitative and sports medicine care.